One of the most commonly recommended medical checkups for seniors after 65 is the routine full body scan, usually in the form of a CT scan or full body MRI, often promoted as the ultimate early detection tool. On the surface, it sounds incredibly reassuring. The idea that you can scan your entire body and catch hidden diseases like cancer, tumors, or organ damage before they become serious. Many clinics even market it as a once-a-year investment in your life. But when we look at the real medical evidence over the past decade, especially studies published between 2018 and 2024 in journals such as Radiology, BMJ Open, and The Lancet Oncology, a very different picture appears, one that is rarely explained clearly to older adults. Large-scale research shows that full-body scans in symptom-free individuals lead to a surprisingly high rate of false positives, ranging between 30% and 50%. That means almost 1 in every 2 or 3 seniors may be told there is a possible abnormality that turns out to be harmless. These findings are often described in vague medical language like shadow, lesion, or indeterminate spot, which naturally creates fear and anxiety. The problem is not the detection itself, but what happens next. Once something is flagged, even if it is likely harmless, patients are often pushed into a chain reaction of further testing. Repeat scans, contrast imaging, blood work, and sometimes even invasive biopsies. A long-term review from the American College of Radiology, 2022, highlighted that this cascade effect is one of the most significant risks of unnecessary imaging. In fact, the study estimated that nearly 1 in 5 older adults who undergo follow-up testing after a false positive experience some form of physical, emotional, or procedural harm. That harm is not always severe, but it can include unnecessary surgical procedures, medication side effects, or long-lasting health anxiety that reduces quality of life. Another important issue is how the human body naturally changes with age. After 65, many organs develop small, harmless irregularities that are completely normal. Tiny cysts in the kidneys, benign liver spots, or age-related changes in the spine and lungs. According to Harvard Medical School research published in 2021, these age-related changes are often misinterpreted by imaging technology as potential disease markers, even though they are not dangerous. This is one of the main reasons why healthy seniors are more likely to receive confusing or alarming scan results compared to younger individuals. There is also the issue of radiation exposure, especially with CT-based full-body scans. While a single scan carries a relatively low risk, repeated exposure over years adds up. A 2020 study in BMJ Open estimated that unnecessary repeated imaging could slightly increase long-term cancer risk due to cumulative radiation exposure. Although the individual risk is small, the key concern is that the benefit of scanning healthy individuals without symptoms does not clearly outweigh even that small risk. Perhaps the most important shift in modern medicine is not about rejecting imaging technology. It is about using it wisely. Leading geriatric specialists now emphasize a symptom-first approach, meaning scans should be used when there is a clear medical reason, not as a routine yearly habit. When symptoms are present, imaging can be life-saving. But when there are no symptoms, research consistently shows that full-body screening rarely improves life expectancy or overall health outcomes in seniors. So the real question is not whether technology can find something. It is whether finding it actually helps you live longer or better. And according to current evidence, for many healthy adults over 65, routine full-body scans often create more confusion than clarity. Another medical checkup that is increasingly questioned by modern research for healthy seniors is the routine annual cardiac stress test, especially treadmill ECG testing performed without any symptoms of heart disease. For decades, this test was treated almost like a standard peace-of-mind screening tool for older adults, something you do every year after 60 or 65 just to make sure your heart is functioning properly. The idea sounds reasonable. Push the heart under controlled exercise, monitor its response, and detect hidden blockages early. However, updated evidence from major cardiovascular research over the last 10 to 15 years has significantly changed how experts view this practice for people who are not showing any symptoms. According to a major scientific review published by the American Heart Association, AHA updated 2022 guidelines, and supported by data from the U.S. Preventive Services Task Force, USPSTF 2018-2023 updates, routine stress testing in asymptomatic adults has very limited predictive value for future heart attacks. In low-risk seniors who do not experience chest pain, shortness of breath, or unusual fatigue, the test often fails to provide meaningful information that actually changes treatment or improves survival outcomes. In fact, studies show that the positive predictive value of these tests in healthy populations can be as low as 5% to 10%, meaning most abnormal results do not translate into clinically significant disease. The real concern begins after a borderline or mildly abnormal result is found, something that is very common in older adults simply due to natural aging changes in the heart, arteries, and electrical conduction system. Once such a result appears, it often triggers a chain reaction of additional medical procedures, nuclear stress imaging, CT angiography, or even invasive coronary angiography. According to a 2019-2023 longitudinal study conducted at Stanford University involving over 20,000 older adults, many of these follow-up procedures did not significantly reduce heart attack rates compared to individuals who were only monitored based on symptoms. However, they did increase the risk of procedure-related complications, including bleeding, contrast-related kidney stress, and in rare cases, hospitalization from unnecessary interventions. Another important factor that is often overlooked is the psychological impact of repeated cardiac testing. A study published by the University of Toronto in 2021 found that seniors who undergo frequent heart screening without symptoms are more likely to develop health anxiety. They begin to interpret normal bodily sensations, like mild fatigue or temporary chest tightness from stress, as signs of heart disease. This fear can lead to reduced physical activity, avoidance of exercise, and increased dependency on medical reassurance, which ironically can worsen cardiovascular health over time. It is also important to understand that the human heart naturally changes with age. Mild irregularities in rhythm, slight variations in ECG readings, and reduced exercise tolerance are often part of normal aging rather than disease. Research from the European Society of Cardiology, ESC 2020-2022 consensus reports, emphasizes that interpreting heart function in older adults requires context, not just machine readings. A treadmill test may detect abnormalities that are simply age-related adaptations rather than signs of blocked arteries. Because of these findings, modern cardiology is shifting toward a more personalized approach. Instead of routine stress testing for everyone over a certain age, doctors now prioritize symptom-based evaluation, long-term risk factor monitoring, such as blood pressure, cholesterol trends, and diabetes status, and lifestyle assessment. Walking ability, daily energy levels, and overall functional health are now considered far more reliable indicators of heart health than routine stress tests in asymptomatic seniors. The key takeaway from all this research is simple but powerful. More testing does not always mean better protection. In fact, unnecessary cardiac stress testing can sometimes create more confusion, anxiety, and medical intervention than actual benefit. For many healthy adults over 65, the best heart test is not a machine. It is how well you can live your daily life without symptoms, limitations, or discomfort. Another widely recommended medical checkup for seniors that deserves careful reconsideration is the routine colonoscopy screening after age 65 to 75, especially for individuals who have no symptoms and have already had previous normal screenings. Colonoscopy is often described as one of the most powerful tools for preventing colorectal cancer, and in many cases that is absolutely true. It has saved countless lives when used appropriately. However, modern medical research over the past decade has increasingly shown that its benefit becomes more limited with age, particularly in healthy older adults who have already been regularly screened in earlier years. According to updated guidelines from the U.S. Preventive Services Task Force, USPSTF 2023, and supporting evidence from large meta-analyses published in Gastroenterology and JAMA Internal Medicine between 2019 and 2024, the benefit of routine colonoscopy screening decreases significantly after age 75 and becomes highly individualized between 65 and 75 depending on previous results and overall health status. One of the main reasons is the slow progression of most colorectal cancers. Research consistently shows that many precancerous polyps take anywhere from 10 to 15 years to develop into a serious cancerous condition. For many seniors, especially those in their late 70s or 80s, this timeline may extend beyond their natural life expectancy, meaning that even if a slow-growing polyp were detected, it might never actually cause harm during their lifetime. At the same time, colonoscopy is not without risks, and those risks increase gradually with age. According to data published in JAMA Surgery 2020-2022, complications such as bleeding, perforation of the bowel, and adverse reactions to sedation occur in a small but important percentage of cases, roughly 0.1% to 0.3% overall, with slightly higher rates in older adults due to frailty, thinner intestinal walls, and existing medical conditions like heart disease or diabetes. While these numbers may seem small, they become more significant when applied to large populations of seniors undergoing routine screening without clear medical necessity. Sedation itself is another important consideration. Older adults often metabolize anesthesia more slowly, and even mild sedatives used during colonoscopy can sometimes lead to temporary confusion, dizziness, or prolonged recovery time. A 2021 study from the Mayo Clinic found that post-procedure fatigue and cognitive fog were more common in patients over 70 compared to younger groups, sometimes lasting several days. For seniors who already value independence and daily routine stability, even short-term disruptions like this can affect quality of life more than expected. Another concept that modern geriatric medicine emphasizes is competing risk. This refers to the idea that older adults are more likely to experience health events unrelated to colon cancer, such as heart disease, stroke, or other chronic conditions, that may have a greater impact on lifespan than a slow-developing colorectal issue. A long-term observational study published in 2021 by the Mayo Clinic and Harvard Medical School highlighted that in many seniors with multiple chronic conditions, the likelihood of benefiting from new cancer detection through routine colonoscopy was lower than the likelihood of experiencing complications or stress from the procedure itself. Because of this, modern medical thinking is shifting away from a one-size-fits-all approach. Instead of automatically repeating colonoscopies at fixed intervals, doctors are now encouraged to evaluate each individual based on their prior screening history, overall health, mobility, and personal preferences. If previous colonoscopies have been consistently normal and the individual is in good health with no symptoms, the benefit of repeated screening may be minimal. The key message here is not to dismiss colonoscopy entirely. It remains one of the most effective cancer prevention tools in medicine when used at the right time. But for many healthy seniors over 65, especially those with a history of normal results, the decision becomes less about routine scheduling and more about personalized medical judgment. In today's evolving healthcare landscape, the goal is not to screen everyone endlessly, but to ensure that every test truly adds value to health, safety, and peace of mind. One of the most sensitive and heavily debated medical checkups in older adults, especially men over 65, is the routine PSA test for prostate cancer, along with broad, full-panel blood testing that is often done annually without clear symptoms. On the surface, these tests appear extremely useful. After all, detecting cancer or internal problems early sounds like the safest approach possible. But when we look at large-scale medical evidence from the past 10 to 15 years, a more complicated reality appears, one that has changed how many experienced doctors now approach screening in older populations. The prostate-specific antigen, PSA, test has been studied extensively in major international trials, including the European Randomized Study of Screening for Prostate Cancer, ERSPC, updated analyses from 2018-2023, and long-term follow-ups published in the New England Journal of Medicine. These studies show that while PSA screening can slightly reduce prostate cancer mortality in younger men, its benefits become much less clear after age 65, especially in those who have no symptoms. In fact, overdiagnosis rates are estimated between 20% and 50%, meaning that a significant portion of detected prostate cancers are slow-growing and would never have caused harm during a person's natural lifetime. The problem begins when an elevated PSA result leads to further investigation. Once the number crosses a certain threshold, even slightly, it often triggers biopsies, imaging scans, and sometimes aggressive treatment approaches such as surgery or radiation therapy. According to follow-up research published in The Lancet Oncology 2020-2022, many of these interventions in older adults are performed on cancers that would have remained stable for years without ever threatening life expectancy. Unfortunately, the treatments themselves are not harmless. Side effects such as urinary incontinence, erectile dysfunction, fatigue, and psychological stress are well documented, and they can significantly affect quality of life in later years. This is where modern medical thinking has begun to shift. Instead of treating every abnormal PSA result as an immediate danger, doctors are increasingly encouraged to evaluate the aggressiveness of the cancer, the patient's age, overall health, and life expectancy. In many cases, a strategy called active surveillance is now preferred, where the condition is monitored rather than immediately treated. This approach is supported by major guidelines from the American Urological Association, AUA 2022 update, which emphasize reducing overtreatment in older adults. Alongside PSA testing, another common practice is the routine ordering of extensive blood panels, sometimes including dozens of markers such as liver enzymes, kidney function, thyroid levels, cholesterol subtypes, vitamin levels, and inflammatory markers, even when no symptoms are present. While basic blood work can be extremely useful when targeted properly, research from Annals of Internal Medicine 2022 and several European primary care studies shows that broad, non-specific screening in healthy seniors often leads to more confusion than clarity. The reason is simple: the human body naturally changes with age. Slight variations in kidney function, liver enzymes, or cholesterol levels are often part of normal aging rather than disease. However, when these small fluctuations are detected through large panels, they are frequently labeled as abnormal, leading to repeat testing, specialist referrals, and unnecessary anxiety. Studies show that this cascade effect of testing can increase healthcare utilization without improving long-term survival outcomes. Another concern is the emotional impact. Research from the University of Cambridge, 2021, found that seniors who undergo frequent broad blood testing without clear clinical need are more likely to perceive themselves as medically fragile, even when they are healthy. This perception can influence behavior, reducing physical activity, increasing worry, and leading to over-reliance on medical reassurance. Over time, this can have a negative effect on both mental and physical well-being. Modern geriatric care is therefore moving toward a more selective and meaningful approach. Instead of routine annual panels for everyone, doctors are encouraged to tailor tests based on symptoms, medical history, and actual risk factors. This ensures that testing serves a clear purpose rather than simply creating numbers that may not reflect real health problems. The central message from all this research is not to avoid testing altogether, but to avoid unnecessary testing that does not change outcomes. For many seniors over 65, especially those in stable health, the focus is shifting from how many tests can be done to which tests truly matter for living better, longer, and with less stress. Now let's bring everything together. After 65, your health journey is no longer about doing more and more tests just because they are available. It becomes about doing the right tests at the right time, based on your actual symptoms, your real risk factors, and your quality of life. As we've seen in today's video, modern medical research from institutions like the USPSTF, American Heart Association, Mayo Clinic, and major journals between 2018 and 2024 all point in the same direction. Unnecessary routine screening in healthy seniors can sometimes create more harm than benefit through false alarms, stress, and unnecessary procedures. This does not mean you should avoid doctors. It means you should understand your body better and ask the right questions. Medicine today is not one size fits all anymore. What is helpful at 45 may not always be helpful at 75. Your body has different needs, and your healthcare decisions should respect that. The most important thing you can take away from this video is simple. Health is not measured by how many machines scan your body, but by how well your body allows you to live your daily life, walking, thinking clearly, sleeping peacefully, and enjoying time with the people you love. If this video opened your eyes or gave you a new perspective, take a moment to support the channel. Like this video so more seniors can see it, subscribe for more clear and research-based health insights, and share it with someone in your family who might still believe that more testing always means better care. And now I want to hear from you. Have you ever experienced a medical test that made you more worried than before, even when you felt healthy? Share your experience in the comments below. Your story could help someone else feel less alone. Remember this: the goal is not to add more years to life, but to add more life to your years. Stay informed, stay calm, and take care of your health with wisdom, not fear.